Hello, my name is Peter Higgins, and this is IBD School. This is the first in the 500 series, a series of videos about how to interpret the results of your tests. More patients are now using patient portals to see the results, but may not know what they mean. In this video, IBD School 501, we will talk about C-reactive protein, or CRP. CRP is a protein made by the liver when inflammation is present in the body. For patients with IBD, it is a bit like a thermometer for inflammation. When the CRP is high, inflammation is active. When the CRP is low, inflammation is well controlled. How is CRP helpful? The CRP can tell you if you have active inflammation without using a scope or a CT or MRI scan. It's a lot cheaper, about $30, and faster, usually returning results in a few hours, than most of our other tests for inflammation. It generally goes up very quickly during a flare and goes down very quickly within 24 to 48 hours when a new therapy starts to help. It can measure the severity of a flare, it can measure the success of therapy while patients are in the hospital, and it can measure whether inflammation is returning after therapy has been tapered or stopped. So what levels of CRP are you looking for in your results? CRP is measured in either milligrams per liter or milligrams per deciliter. It's really important to look at your report and see which one. If it is in milligrams per deciliter, multiply the number by 10. I will be referring to the values in CRP in milligrams per deciliter. A good CRP is between 0 and 5, 0 and 0.5 in milligrams per deciliter. This is generally considered no inflammation or remission. A CRP between 5 and 10 is considered smoldering inflammation. This often occurs in patients about to have a flare or recovering from a flare. A CRP over 10 is active inflammation. Higher levels suggest more inflammatory activity. We can see levels up to 200 or more in young patients with severe inflammation. When is the CRP less helpful? There are 3 times when CRP can be less helpful. CRP detects inflammation anywhere near the bloodstream, which is most of the body. This means that inflammation somewhere else, from a cut, an infected tooth, or inflammation of the joints, can give you a falsely elevated CRP when your intestines are in remission. CRP is not specific to inflammation in the intestine. Second, CRP is less sensitive in some people who make less CRP until they have really active inflammation. About 25% of the population are low CRP makers. They don't make much CRP until they have severe inflammation. It is important to know if you are a low CRP or a high CRP person, and how high your CRP goes during a flare, and how low it should be when you are doing well. Third, CRP is less sensitive to mild inflammation on the surface of the colon. People with mild ulcerative colitis can have a few shallow ulcers and not make much CRP. How can CRP predict the future? CRP can often start to go up before patients have symptoms. Patients with elevated CRPs, especially above 10, are significantly more likely to have a flare in the next 12 weeks. Patients with low CRPs, 0 to 4, are unlikely to have a flare in the next 12 weeks, especially if they continue to take their medications. In summary, you can think of CRP as an inflammation thermometer, an early warning system, or reassurance that your medicines are working. It is important to know your highest CRP during a flare and your lowest CRP during remission to calibrate your personal inflammation thermometer. This can help you track your own inflammation over time. It is important to know if you are one of the people who don't make much CRP during inflammation, as this will make your CRP thermometer less useful. If this is the case, you may need to use a different marker of inflammation to follow your disease activity. For many IBD patients, CRP, a sed rate, or a stool marker like calprotectin can be a helpful way to inexpensively follow your disease activity without invasive or expensive tests.